Diabetes. It is often perceived in a layman language as blood sugar. It is becoming a deadly disease in today's lifestyle, and it would not be wrong if we perceive it as slow poisoning or slow killer. How does Ayurveda is beneficial in treating diabetes?
See, when it comes to diabetes, you have rightly mentioned that it's a slow poison. When we talk about any diabetic patient, the worst part of diabetes is that despite keeping the blood sugar level under check, despite following the do's and don'ts that are guided by allopathic doctors, still after 15 to 20 years of being diabetic, diabetic neuropathy, diabetic retinopathy, diabetic nephropathy and various other kinds of problems are very common to occur in diabetic patients. That means that it's not just the blood sugar level which has to be kept under control. There is something which is the very base of diabetic treatment here at NDK Nirogam Private Limited. Diabetes is a lifestyle disorder and it's a very ancient kind of a disease. Once, as far as Ayurvedic texts are concerned, someone asked Brahmaji that if a patient becomes diabetic, what should that patient do? And the very reply to that from Brahmaji was that the person should have a begging pot in his hand and should go begging for 100 homes. Now that was a very strange answer. It was very difficult for everyone to understand that. One of those ancient mythological characters, Naradji, then asked about the reason for that, and Brahmaji explained that when the person will go from one house to another, and at that time one home was at a difference of 1 yojan from the other home, the person will travel a distance of 100 yojan. That gives the indication that how important walking is for a diabetic patient. And the second thing, the significance of having a begging pot in the hand is to restrain from various kind of stresses. Today in the modern living, we are all suffering from various kinds of stresses, and definitely we cannot hold a begging pot in our hand. But then we can definitely start meditating and make meditation our lifestyle so as to relieve those stresses to some of an extent. So these are two very common requisites that are to be followed by any diabetic patient. Now when it comes to the line of treatment for diabetes at our center, the first line of treatment is that we provide the patient with metabolic correctors, because in majority of the patients who approach us, controlling blood sugar level is not a very big problem. They are already taking allopathic OHDs, that is oral hypoglycemic drugs, or they are on insulin. They are already taking those medications which is keeping their blood sugar level up to control to some of an extent. But what they are not keeping a control on is the slow and gradual creeping in of diabetic neuropathy and nephropathy, retinopathy and such kind of diabetes related diseases. So that is why we on the very first day of treatment start these metabolic correctors in our patient, so that at any stage of life he does not catches these diseases. The second important thing which we do over here is providing the patient with phytoinsulin. Those plants, those herbs, the leaves of which or various parts of which contain plant insulin. The extracts of those herbs are used in our medication so that the burden on pancreas is reduced. We don't make the pancreas overwork by compelling them to excrete more and more insulin, which the oral hypoglycemic drugs do. That is why after the usage of OHDs for certain years, the patient has to shift to the insulin. But since we are not making the pancreas overwork, we are rather decreasing the workload by giving phytoinsulin. We make that work easier. And the third thing, we provide with those herbs which provide a bit of pancreatic repairing features. That is the third thing which we are providing to our diabetic patient. As a result, if a patient starts with our treatment, follows our do's and don'ts, a good percentage of patient can expect that they don't have to take a medication after a few months or years when they change the lifestyle. There are others who are diabetic since long, in whose case we cannot get rid of those medications, but we can definitely start the patient taking our medications rather than being on insulin. There are others in which we can significantly reduce the dosage of insulin that is being taken. So the recovery level and the type of recovery may vary from patient to patient in a diabetic patient with the help of our medications, but we are able to provide recovery to quite an extent.